We have here with us today Dr. Randeep Guleria, Director in Medical Education at Medanta. He visited Bennett University as part of the National Science Day celebrations to deliver a talk on Global Science for Global Wellbeing. Padma Shri Award winner and Chairman Institute of Internal Medicine, Respiratory and Sleep Medicine, Dr. Guleria is globally renowned for his vast experience and exceptional contribution to India's COVID response as the then director of AIIMS. Thank you for joining, Doctor. So my first question is, what do you mean by global well-being in context of today's world?
So I think when we talk of global well-being, it becomes very, very important after COVID-19 because there was a lot of inequity as far as global well-being was concerned. If you just look at vaccination, there were certain countries where they were able to give multiple doses of the vaccine, and there were a large part of the world where there was no vaccine available for a very long time. So when we talk of global well-being, we're looking at the planet as a whole and the entire population of humans and animals as one. And we're looking at the well-being of every individual, irrespective of the place where he is, the socio-economic status the person has, or whether he belongs to a developed or a developing country. That is very, very important. And I think it becomes more important now because the world is becoming a global village. If you are not able to have global well-being in one part of the world, it will translate to the other part as people travel, as they carry the infection, as health becomes an issue in that part of the world.
My question to you is, how will the change in demographic patterns, like the growing population of the country and also expensive healthcare resources, affect sustainable healthcare innovation in the long run?
So it's going to be a big challenge because two things are happening. One is not only is the population increasing, there is a change in the demographic profile of the population. We are seeing an older population, an aging population. We are seeing a shift from communicable to non-communicable diseases. And along with that, like you rightly said, there is a shift from clinical medicine to investigative medicine. So the cost of healthcare has become much more, and therefore many people who need healthcare are not able to afford it because it's an out-of-pocket expenditure. So we have to be innovative in finding solutions which are cost-effective, and at the same time we have to develop strategies where there can be equity and the healthcare can reach out to everyone, even in the remotest part of the country.
So like you mentioned that there's a shift from communicable to non-communicable diseases, but with the pandemic again coming into picture, which is a communicable disease, do you think that we are somewhere again moving towards communicable diseases, but this time with a longer effect?
So I think the pandemic just shows that communicable diseases are important, especially when we're looking at outbreaks. But if you even look at the context of the pandemic, the burden of disease in terms of morbidity and mortality was among those who had non-communicable disease. Older people, diabetics, hypertensive, heart disease patients, chronic kidney disease did worse even in the pandemic. So even then we have to focus on strategies for non-communicable diseases, but at the same time develop strategies to prevent outbreaks of emerging infections which we are seeing at a global level.
And so also, from where did the idea of One Health came into being? Like, can you tell us more about it?
So One Health is an idea which has been there. WHO has a whole section on it, and that is basically because of the fact that it's become more and more apparent that when we start looking at health, it has to be also animal health, the plant health and the environmental health, because they're all interlinked. COVID-19 showed that a virus which was basically in bats jumped species, became a human virus and caused a huge havoc as far as humans were concerned. Previous outbreaks have also showed that. So infections are moving from one species to the other and causing problems. And therefore we have to look at health of not only humans but animals, the environment and plants itself, because that is also very, very important. Even when you talk of pollution, air pollution, e-waste, water pollution, that also should come into One Health, because that also affects the health as far as not only humans are concerned, but crops, planets, animals all get affected by pollution or by whether it's air or soil or water pollution.
So recently in the Union Budget 2023, we have seen a hike in the allocation of budget in healthcare and startups department. So how much do you think will that help in strengthening the concept of One Health?
So I think that will go a long way in strengthening the concept of One Health, because there has to be support in funding if that has to be taken forward, in both in development of infrastructure, in both in supporting research in this area and developing academic activities. So I think this is a good step, because there is a need for us to develop strategies for looking at health which is at a global level and at a One Health level, rather than just looking at it from a narrow point of view.
So you talked about frugal innovation, jugaad, as you said. So do you think that this frugal innovation can make people take more shortcuts, and it will also have a detrimental effect on the quality of treatment?
So when we talk of frugal innovation, it means doing things in a cost-effective manner without compromising on the quality. So it's not that you do something in terms of shortcuts. You develop something which is cost-effective but still are able to provide high-quality care. And that is possible and can be done in countries like India, where there is this need. But I think this is going to have a global impact, because the cost of healthcare is not only high in India, but even if you look at the Western world, they are also looking at frugal innovation to be able to cut down the cost of healthcare.
So my last question to you is, as you talked about the growing number of NCD cases in the country and also lifestyle-related problems, for example, diabetes. So we are, the youth of the country is more prone to acquiring these diseases because of their unhealthy or bachelor lifestyle. For example, diabetes, according to the government guidelines, the screening age of diabetes is 35 years. But people belonging to the age bracket of say 19 to 30 years are more prone to acquiring this disease. So do you think there's a need to modify government guidelines and policies as well?
So gradually the guidelines will get modified once you screen that part of the population. It's the important issue here is two. One is picking up diseases early, that is having a cutoff and being able to then cover that entire population. And remember, it's not one time. You may not have diabetes on the first visit, but if you visit a person 3 years later, he may now have high blood sugars. So when you're talking of screening people, it is a continuous process. The second is education in terms of lifestyle modification. If you have a family history of diabetes, if you have a family history of heart disease, what are the things that you need to do? Or for the youth, what are the things that they generally need to do to be healthy in terms of their diet, in terms of physical activity, in terms of addictions, whether it be smoking, alcohol, tobacco. So all of that needs also a lot of push in terms of education in the younger generation, and also supporting them in terms of adopting this type of lifestyle.
Thank you so much. Delivering affordable and quality healthcare to India's growing population presents enormous challenges and opportunities. Sustainable healthcare innovations could be a way out for a large number of people to get quality care at a cost that the nation can afford. Though this seems challenging, it is achievable for a country like India. This is Palak Narula with Smiti Goyal for BUTV.